Welcome to the Southeast Retirement Planners Podcast, where we will go beyond the balance sheet with our guests, not only to share from our personal experience as financial advisors of over 25 plus years, but also to learn from our guests about the issues and topics that are important to them. Our firm specializes in taking care of the financial plans for individuals and small businesses by helping our clients identify their individual goals and taking a conservative and ongoing approach to helping accomplish them. We are located in Hickory, North Carolina, and look forward to continuing to serve our clients and our community. Thank you for joining us. We hope you enjoyed this week's episode. Jeff, thanks for joining us on Southeast Retirement Planners Podcast. This is going to be a very interesting episode, and I'm looking forward to hearing what you have to share from your expertise for our audience. And I'm going to give you all just a little bit of background on Jeff, but please go to our YouTube channel, click subscribe, make sure you go to Spotify or Google Podcasts and subscribe to our podcast there so you can keep up with what's going on with our office and with some of our podcasts. But today with us is Dr. Jeff Neal, and Dr. Jeff Neal, DO, Doctor of Osteopathy.
That's
correct,
right, Bob.
So we'll get into that in a second. I think that's really interesting.
Thanks for having me, buddy.
Yeah. Jeff is a good friend of mine. We've worked together for some time. He's an interventional cardiologist and also the medical director at Catawba Valley Cardiology. Is that right?
Yeah, that's right, Bob.
Okay.
I've been over there 7 years now, going on 7 years, which time flies, right?
Yeah, so you came in here, 2014.
I know. I met you. I was thinking about this last night. I think I met you 4 months into Hickory.
Okay.
And we've known each other since, which is crazy.
That's kind of wild. Well, you have one of the things, what I want to talk about today really is a couple of things. I think from my side of the table, when we do financial planning with clients and when we sit down and talk about things, and if you listen to any of our content or if you've had a chance to meet with anyone in our office, you'll find out that it's really more than just looking at the statements and making the investment decisions and just deciding on, well, here's the best investment strategy for you or whatever. We really want to kind of broaden and go what we say sort of beyond the balance sheet and talk about a lot of things that are going on in your life. And some of those things are health and wellness things, and some of them are meeting with attorneys and making sure your wills and healthcare directives are updated and all that kind of stuff. So college planning, all the, even budgeting and managing debt and all the little bits and pieces that kind of fit into that full equation. And I don't want to get into all that today, but what I did want to talk with you about primarily is the idea that we see more and more health is wealth. Yeah. I mean, that's... At the end of the day, that's Bob. Really what it is.
Yeah, truly. Yeah, that's good. I don't think you could probably introduce this kind of amalgamism we're going to do here with the financial side and the health side better. Yeah, you're true. What I do daily typically is I see people at the worst point of their lives, Cardiovascular disease still, you can add up. I was kind of looking at some of this last week as we were talking. You can add up every cancer in the U.S., and every lung disease in the U.S., and cardiovascular disease still trumps them in mortality in the U.S. It's the prevalence is unbelievable. I did not know that. Yeah, it's unbelievable.
So this is a huge problem. It's a
heart
huge
attack
issue.
Every 39 seconds in the United States. But you're right, Bob. If you're gonna kind of
looking at my watch, oh no.
But if you're gonna bring those two together, I catch people typically at one of the worst points of their life medically. I think your side of the house, which is honestly just as important, kind of comes into play after the fact. And typically, I think, I've been guilty of it in the past. I don't know if people really think about those two connecting as much until it happens to you.
Oh, I think you're absolutely right.
Yeah, major medical issue, whatever it is, car crash going down the road, for in my instance, major heart attack, you're in the ICU 9 days, and a lot of times you hear these people that wake up and, they look at me, hey, doc, man, I had this thing planned out till I was 85 years old, going to take the Class C and go across the country. And all of a sudden they're like, oof, so yeah, I see it daily, man, I do.
Well, before we get into too much of the details of cardiovascular disease, and really what I wanted to talk about was some of the stressors. I mean, we talk about risks in my business all the time, and risk to portfolio and risk to financial plans. There are a lot of risks in the cardiovascular space. that I want to touch on. But you have a pretty unique background. You didn't go, private school to Ivy League to medical school, right? I mean, why don't you share a little bit about your background?
It's thanks for asking this kind of loaded question. I guess I'll try to tighten it up. I'm from Virginia. Grew up really small town in Virginia. Grandfather was a tobacco farmer, kind of classic out rural country. Played a ton of sports in school. Never really thought about college. At that time, it was a little bit different. We didn't prepare when we were in 7th grade to go to Harvard.
Right.
You roll up to be a junior, senior. We apply to college. I go. After that, I had a couple mentors when I was young that were pharmacists, kind of the classic small town pharmacist. The guy that
they used to call him druggist.
Yeah, the druggist. Wore the tie every day, and everybody went to these guys for information. So,
right.
Emulated those guys, wanted to go to pharmacy school, ended up going to pharmacy school, got a doctorate of pharmacy. Life was good. I'm 5 years into it, and I guess we all have our own life story, and I have a huge respect for pharmacists. This is not knocking the profession. For me personally, I just felt like I needed a little something else. We're originally from close to Blacksburg, Virginia, moved back there, and they were opening up a medical school, a DO school. Similar to you, Bob, never heard of a DO in my life, had no idea what it was.
That's very interesting.
Went over, took the MCATs, actually cold after being out of school 10 years, and actually did pretty well on those, which was probably as shocking to me as anyone else. But interviewed, got into school. And so I just kind of went on this 11-year midlife crisis to become an interventional cardiologist.
So you pharmacy school pharmacist, and
pharmacy
then went
school residency.
No, I think I'm going to go back to medical school.
Yeah, pretty much. Yeah.
And how old were you when you did that?
I was 35 years old, and I had a 6-month-old daughter. So my wife was really happy at that time. But Bob, it's been I don't really say this much, and I don't want it to come over the wrong way. It's been the best decision of my life. I truly, honestly can say every day I love what I do. I know people say this, but honestly, there has not been a day I've gotten up that I've not been like, I have to go to work. It's been
your path kind of creates a little bit of gratitude there, just the way that you've done it. It's not your normal kind of, this is the journey I'm on, and it's been the journey I've been on this whole time. And so you've done things a little different. How about the fact that you made that decision and you had a 6-month-old child,
right,
who just went to senior prom, by the
way. Another story for another day, Bob.
Good grief.
Yeah, that was kind of tough.
And you have two more sons. You have your daughter, Emma, and then 2 sons.
My daughter's 18, going to the University of Tennessee in just a few months, and have a son that's 15, son that's 14. And it's been different.
And your wife she rides behind all that and helps keep everything going
she
the
does,
whole time. She's a rock star.
She does all that.
Yeah.
I give her all the credit. If I didn't have her, the thing would fall apart.
Yeah.
So that's what I do.
That's wild. Well, I've had the opportunity to spend time with you through the years in a couple of different capacities, when we're with our kids or when we're coaching ball teams or doing financial work or even medically. I mean, we had a small surgical incident with my son at one point that you helped us out with.
Yeah, I forgot about that.
But, one of the things I find interesting is the challenges that you face on a daily basis with the kind of work that you do. So as an interventional cardiologist, what are the things that you're doing on a regular basis?
Yeah, it's, I actually learned a lot of this on the fly, Bob, when I was going through the training. In the U.S., primarily you graduate medical school, you can either specialize into OB or family medicine, urology, but a vast majority of us go into internal medicine or surgery. Mm-hmm. From surgery, you can be a general surgeon or branch out to be a plastic surgeon, a cardiothoracic surgeon, that kind of stuff. In internal medicine, you can be a gastroenterologist, pulmonologist, cardiologist. So I've always had a draw towards that kind of numbers, closed system thing. So I went cardiology.
Okay. Yep.
And after that, you can actually, believe it or not, subspecialize again into multiple fields. Interventional cardiology, in particular, deals with coronary artery disease and particularly heart attacks. That's what we do.
So lots of stents.
Stents,
Are you involved in open heart surgeries?
I'm not, but it's I work hand in hand with surgeons every day.
Okay.
Anyone that ever has open heart surgery prior to having that, an interventional cardiologist will do a cath, and he'll make the decision, he or she will make the decision, you need open heart surgery, I'm going to stent that.
Yep, okay.
Now, many times we talk to the surgeon like, hey, I've got this, and here's what I think, and they'll give us an opinion. But, we work hand in hand with those guys all the time. In the U.S. right now, just for what I do, and this is probably a little bit more than your audience wants to know, but of every 100 people we bring to the cath lab, we need to do something in 40 of them. Of those 40, I can fix 30 with stents. So about 10% of the total people we bring to the lab need open heart surgery.
Okay, and 30%.
Yeah, we stent them up. Yeah, we drop.
Now, how long does a stent normally last?
Yeah,
and how that procedure? It's not through this. It's not through your chest generally.
No, yeah, we.
Right? I mean, I know some of this, but maybe some people don't. I don't know.
We're proceduralists. We gain access to arteries. So, if you kind of look globally from the 30,000-foot view, you can think about arterial blockages. The problem, and a lot of people don't realize this, you have the venous system in your body and the arterial system. Venous system is very redundant, so that's bringing blood back to the heart. Okay. So everything's coming back to the heart. The arterial system in general is kind of a one-way street. You've got one artery going to one place, and it's going to feed that. If you get a blockage in a one-way street, you're not in good shape.
You're in trouble.
Right. So if you look, there are different vascular beds that people deal with: the legs, the belly, the heart, and the head, strokes. Okay. So it's all kind of the same thing with different vascular beds.
Okay.
So that's kind of how that works.
So most of the time when somebody presents at the hospital with a coronary issue of some sort, it's related to some kind of a blockage. At least when you get involved, it would be some sort of a blockage or an impediment of some sort. What are the reasons why that happens?
Yeah,
typically?
so
I guess would be the way to ask it.
Yeah, that's a good question, Bob. For me, as I've done this more, and I appreciate you asking me that. When I first started doing this, your hair on fire. You want to be in there at 3 a.m. with this massive heart attack, trying to save somebody. That whole thing. I still enjoy that, but as I've kind of aged out, I kind of like the preventive side of it more, because what I do now, if you think about it, if you come into me and you have a massive heart attack, the horse is out of the barn.
Yeah, right.
And for me now, I like to back up and catch people in clinic that aren't quite there yet, but they're heading down that road, and kind of cut that off. That's like a passion of mine now. I still love what I do. I still like going in and opening them up and, getting people through that. But I kind of like the back part of that. And I just see a lot of people, Bob. You'll see, I have people come to me in clinic, even in the hospital. They're just the overt guy on fire. He's giving you every word in the book that, this guy has a problem. And we take him. I see lots of 35, 30, 40-year-old people come in. Hey, doc, man, I'm doing well. Used to work out like crazy, still working out. Walk up some steps, feel kind of funny in the chest. So I work through all that. I'm a numbers guy. I'm a cardiologist. If you look at coronary artery disease, it's still, of all those things I listed before, so if you look at cardiovascular disease in general, heart attack, stroke, high blood pressure, other vascular blockages, things like that. That's your number one killer. Of all those, cardiovascular disease or blockages on the heart is your number one by far. It's still about 15%. And so when I look at someone like that and I'm trying to tell them what can you do, it's kind of interesting. There's a ton of literature out there. And in the U.S. right now, unfortunately, the deck is stacked against us.
We're not doing too hot.
We're not. If you look,
on a relative scale, I guess.
Yeah, it's kind of rough.
So, I mean, that's what do we? All right. So, for me, it was a while ago that we met.
Right.
we've gotten older since then, right?
Speak for yourself.
It's getting harder and harder to do the things we're supposed to do, to stay in the kind of shape we're supposed to stay in. So one of the things I wanted to try to break down, if we have maybe just, I guess, for starters, what do we pay attention to? There's all these contributing factors. So we've got like diet, exercise, genetics, supplements that you're taking or vitamins you're missing or whatever. I had a guy tell me a couple of years ago that when it comes to heart attacks and heart disease, I don't remember what the percentage was, but he was basically like, 80% of the cause is something you can't do anything about, and that's your genetics and your sex. Not like how frequently you have sex, but whether you're male or female, like that's.
I was getting to say,
because I was like,
destined for a heart attack.
It's a whole nother podcast. No, but know what I'm saying? So I don't know if that's accurate, that your genetics and if you're a male, has a large percentage to do with the likelihood of something like this happening. But then, of course, I'm sure diet and exercise and all that matters too.
Yeah, we always say in our profession, the only thing two docs can agree on is what the third one did wrong. So unfortunately, your friend was wrong. I always boil this stuff down, and I live it. So I guess I'm a little more in tune than the general layperson. But I always boil it back to the basics. Like everything, you can always bring it back. There was a large study, I reference it a lot, in Sweden. It was kind of interesting. They took 21,000 people, and the men up front, and these were mid-20s to 70.
Okay.
21,000 people. Followed them longitudinally for 11 years. They started this in 2003. It was reported in our literature 2014. Interesting study. So they peer matched these guys. They had no disease. So they had no high blood pressure, no heart disease, no diabetes. They got the cleanest group they can. Now, before I go any further, just kind of what would you say it? A statement, I understand. This is observational data, so it's not the strongest data you can get. Like the randomized controlled trial, obviously, is our gold standard in the U.S. But
right.
I think this holds some credence and it answers your question. 21,000 people, they followed 11 years.
Okay.
They looked at people that had events, heart attack, stroke, cardiopulmonary arrest. And out of that study, they defined 5 risk factors that would decrease that by 86%. Not smoking.
Okay.
14% of us still smoke. 25%, again, I looked at this last week when you and I were talking, 25% of the kids in high school now, secondary to the vape, have smoked. And that is a huge jump over the last 5 years.
I was going to say, I felt like that had kind of gone away, but now we're going back to the original.
Because of the vape, they switch off the vape to the cigarettes.
And everything else, so they think this is somehow
because
safer.
The general population is only like 14% now. But anyway, so smoking, huge. Abdominal obesity, keeping it down below 38 inches in a man, 36 in a female. Diet. So I'm asked this every day of my life. How about we come back to that one in a second? I'll talk about it. Exercise. It's not what you think. Coming from your background, Bob, I mean, you're a Trojan, right? You play college football. You're on it. You know how it is. The American Heart Association actually defines exercise, walking, a brisk walk, 30 minutes, 5 days a week.
Yeah.
Yeah, you can bring that up to kind of more intense stuff, 75 minutes a week, but it's not like people think. Bring that up. And, the last one, let's see, I have diet, I have smoking, I have exercise, abdominal obesity, and did I get diet in there?
Yeah, diet was in there.
There was another one. But these are all controllable risk factors.
Okay, and those reduced the likelihood by 86%.
86%.
Okay.
So when I talk to someone in clinic, I think of them 2 different ways. I think of them medically. So I break out all the cholesterol panels, the high blood pressure panels, the numbers you need to hit that way. But I think what we're missing in the U.S. right now, and I think the literature is pretty bad about this, there are so many things that are within everyone's control. And I'm not telling you that I'm excellent at all of these.
Yeah.
But it's the simple things. It's getting out there every day and pounding pavement. It's this, the diet, that's, loaded question in the U.S. because of the way we collect data for diets. But basically, if you boil everything down, if you go through South Beach, you go through keto, you go through the Mediterranean, you go through, name a couple more, Atkins.
Weight Watchers, whatever.
When you boil all this down to their basics, it's a plant-based, primarily diet with a little bit of lean meat. And you can break that out anyway. The NHANES,
What about vegan?
Yeah, vegan's excellent.
Yeah, I've heard.
Vegan's excellent. On the flip side, I'm asked every day about keto.
Yeah. All the bacon you can eat.
Right. Keto's interesting. It works. So if I had a young kid that's trying to put on bulk and cut down, I would tell him, go keto. I've never believed in extremes. I don't think personally it's healthy to push your body into ketosis.
Yeah.
I am on board with the very low carbohydrate diets. But long term, those haven't shown a lot of cardiovascular benefits. But they will absolutely have you lose weight and change your body composition.
Which may allow you to do those other things better, which may in turn help with your cardiovascular health.
It's true.
It's
true. And it's a tough question. We're not doing a good job of answering that.
Yeah.
We're just not.
Well, everybody wants a quick fix.
They do.
So,
that's... those keto type diets, those low carb diets, they'll give it to you. If you're strict, if you hit it hard, 6 months,
you start with a significant headache and a real bad attitude.
Yeah, and then you get this flu thing that you're hanging off for like a week and nobody wants to talk to you. Yeah, but they work.
Yeah. Well, one of the things before we get into, I want to ask you maybe more directly, kind of two parts to you've sort of laid the groundwork and kind of set the stage for what we wanted to cover. One of the things I want to get to in a minute is, all right, so what are the tips, right? What are the things we can be doing? And I think maybe that might be the second question. The first one is, where do we start? Because for someone like me, I don't go to the doctor often. Thankfully, I don't need to go to the doctor often. But then you go to the doctor. Do you need to go get a checkup? Do you need a blood work done? Do you need to have an extra type of blood work done? Get those numbers. What are the cholesterol numbers we need to pay attention to? What do we not need to pay attention to? Because once we do that, our doctor should help us with that. But I kind of want to give a little bit of background so that you know what to expect when we go in there. But before we do that, we've worked together for a while and have had a lot of different experiences. And so one of the things that I wanted to ask you, and I ask all of the guests this as well, from a financial planning standpoint, we talk about kind of making sure we're aware of the risks for cardiovascular disease and keeping that up. We worry about the risks to our portfolio and our financial plan. What is the worst financial decision you've ever made or piece of advice you've ever been given? Do you know what that would be?
Yes. You're not asking hard questions here or anything, right? Yeah. Yes, I can do that. I wish... So during my upbringing, I was kind of a lone ranger. I kind of went to college on my own. I have loving parents, but I kind of did a lot of it on my own. Figured out financially. I paid for all my college by myself, everything like that. When I was 20 years old, I wish someone would have grabbed me and explained the concept of simple interest to me. And I'll give you two examples, right? So, you go to college. You're there, your buddies grab you, you're going to go eat. You're like, yeah, you go to the cafeteria, you walk in there, and, I'm just thinking, you see that like panacea you've never seen in your life, that big silver chocolate milk machine. And you're like, you give the lady your little thing, she hits your card, and you can drink all the chocolate milk you want. I still can't believe that. But, so you eat your 2 cheeseburgers and 8 glasses of chocolate milk because you're 19 and, you still weigh $170. Yeah, you can. So you come back out and you're walking out, and this happened to me. This is the reason I'm saying it. So you walk out, and there's a guy standing there, a girl standing there. Got a table set up. Hey, got a T-shirt, right? Hey, come on over here, man. I got a T-shirt for you. Got nice T-shirt.
Everybody needs a good T-shirt.
College logo on. Hey, all I need you to do is fill out this application for me. What's this for? Credit card, man. It's great. Just fill this out. You get this free T-shirt. There's a line. 50 people. We're all like, hey. So I get this credit card in my second year of college. End up probably getting 2, to be quite frank with you. graduate college, get a job, and then start looking back, and I'm like, hold on now, that's 28.99% interest on my $1,200 credit card, which I'm paying $17 a month on for 85 years. Same thing with cars. I was that classic guy. I go down and get a car. I work. I make some money. Not much money. I'm going down looking at cars. The guy comes out. What's the first question he always asks you?
What you want your payment to be?
A month, right?
That's right.
Exactly.
That's
It's
right.
how much you want to pay for the car? Never.
Yeah.
How much you want to pay a month, man? $100, dude. $100. He's like, oh, I got you, man.
I got a deal for you.
I go over and buy, a 1987 Ford Escort for $8,000, and I probably ended up paying $90,000 for it. But yeah, 19.99 for 8 years. I have no idea, but yeah, I wish at a younger age. Seriously, I would have understood a lot of that, like the value of cash.
Yeah.
And staying away from a lot of that stuff, because it can put you, and I've seen it. I mean, I was very fortunate that I figured it out kind of the thing and I got out of it. I've seen it put a lot of people in a hole quick. I mean, you graduate college, 3 or 4 credit cards and you got 10 grand on that thing at 30% interest. It can hurt you. But,
well, and student loan debt's no joke. You may have heard.
Yeah, I've had a little bit of that in my life too. So yeah, those are, but really I think especially the younger generation, that's never really taught to you.
No,
if you're fortunate and you have
that.
some kind of astute parents, they might, but that one, that's probably the biggest one for me.
Well, what do you think? I'm glad you didn't say horses, by the way, because I thought that might be what you were going to say.
No, I'm not going down
that. But you
that
can't.
way.
Yeah, we got to keep Emma.
Yeah,
she's close to home right now. She's close to home right now. Don't make her mad before she leaves.
True.
So that's maybe worst experience.
Yep.
From an investment standpoint or whatever. What is maybe your best piece of investment advice you've ever been given, or investment decision you've ever made?
Yeah, I thought about this for a while. Just early and often. I mean, that's
socking it away.
Yeah, early and often.
Yeah.
No matter where you are. I was fortunate, and then when I kind of figured out some of the, I wouldn't call them games. What would you call that? With these interest things, when I kind of started working through that and reading it for myself, when you get a little less trusting as you get older and you start looking at yourself, I kind of figured a lot of that out. And a lot of guys that were mentors to me in the medical field and everywhere else, early and often. Fund it.
Yep.
What is it? Buffett said I'm going to butcher this, but the power of compounded interest is the most powerful thing in the world, or whatever. Yeah, but it truly is. I mean, early and often. If you
do it when you don't think you can, to the extent that you don't think you can afford.
Yeah,
I mean, that's you got to do it. Do it when it hurts, and it'll stop hurting eventually.
With my kids now, that's basically what I tell them. It's not like I'm a financial guru. But I tell them, stay out of debt with the silly stuff. Get a job, put your money away early, and by the time you're 50, you have options.
Yep.
If you don't make those kind of decisions at those points in your life, then it can be a little more difficult, I guess you should say.
I'd say, a lot of the discussions we kind of start over the years. It's become more multi-generational financial planning with the work that I do. So I end up talking with grandparents or parents or grandchildren, or, kind of through that whole lineage and the idea of legacy, all that. And a lot of that conversation ends up being kind of the general budgeting type conversations about what is it that you're doing. And so what I tell young people all the time, and we do this with our kids as well, is every time you make $1, every time you get money, I don't care whether it's for your birthday or for Christmas, or you go earn money cutting grass or whatever, you got to do 3 things with every dollar. You save some, you spend some, and you give some away. Yeah. That's it. And you got to figure out how to do that. And early on, it doesn't really matter what the ratio is. You know what I mean? You just have to commit to the concept of every time you get $1, you do 3 things. You save some, you spend some, and you give some away. So that right there is a good foundation for just kind of getting that early and often concept going.
Yeah, I think Honestly, Bob, I've realized this, again, the more and more I've practiced medicine, and I know people are like, how does that tie into medicine? If you really look, a lot of the things that we do in life, and it's a multi-billion-dollar industry, but it's habits.
It is discipline.
If you embrace the suck, they say, what is it they say? Discipline is freedom. Mm-hmm. It's a hard lesson to learn, but it's true. And it's not like I can say I'm the man, but if you get out there every day, put your shoes on and pound the pavement, if you lay the cigarettes down, if you watch your diet, you push away from the table.
I've stopped smoking. I have.
But 86% of the heart disease and everything I see is gone. If financially,
I feel like I'm already ahead just by quitting smoking.
I think you got it, man.
I mean, I never started.
Financially,
except
it hurts.
for once.
I mean, financially, it's easy to say, but when you're 29 years old and you got that starter job and you're 30 grand, 40 grand. It's hard to look in the mirror and, be like, all right, I'm going to put X amount of this back.
You got a plan. All right. So back to cardiovascular stuff. Right now, if we're in a place or somebody who's with us is in a place where they're thinking, I haven't been to the doctor in a while, whatever, need to keep an eye on this stuff. Maybe you have a history of cardiovascular disease in your family. That's really important to pay attention to. If mom or dad or grandparents had heart issues. So what do we need to do? We need to go to the doctor. We need to have tests run. We need to have blood work done. Like what is an EKG anyway?
Yeah, no. So you gave me the classic multi-level question.
Yeah. You feel free to just blither around on that.
So an EKG, to back that one up, that's measures the electrical activity of the heart. So when you go in, have you had one?
Nope.
They put these little stickers on your chest. There are 12 of them. And they have a wire coming off. And what they're measuring is the electrical amplitude of the heart in 12 different planes, you would say. They give us, actually for a simple test, they give you a ton of information about the heart. A ton of information. We can look at electrical, like rhythm issues.
Okay.
Obviously. Blockage issues, they're pretty good. The guys at Sanford and Son on me, you're old enough to know.
Elizabeth.
Yeah, the guys that fall out, I go run them for. Very sensitive for that, like over 90%,
Okay.
Some things not so great, about 70%. If I'm talking to a general layman, really haven't been to a doctor. I'm kind of like that too. I don't love doctors. It's always a running joke. None of us have doctors, which I shouldn't say. But it's everyone should get an annual checkup.
Okay.
Starting at about the age of 40. You mentioned genetics a couple of times. There's a disconnect there. Genetic heart disease, and I'm talking particularly about coronary artery disease, it only counts in a first-degree relative male under the age of 55, female under the age of 65. So mom, dad, brothers, sisters having heart attacks, 55, 65. That being said, when I see people in clinic and they're like, Uncle Jimmy, my grandpa Frank, and they have this huge thing, my ears still kind of perk up. But
so you pay attention to it, but that doesn't mean there's a direct correlation.
Yeah, when you really get to the guidelines and boil that down, it's really not what most people think. Just start simple with all the lifestyle activities I was talking about. Mm-hmm. But if you're looking at parameters, you want to look at a couple changes aspirin. That's what I'm asking every day. Hey, take a baby aspirin or not.
So whether you need it or not, you should be taking baby aspirin every day?
No, you should not.
Oh, okay.
So if that's considered primary prevention,
okay,
which means you have not had an event yet.
Okay.
You have not had a heart attack.
So if I just want to go get a checkup, what am I looking for? Like, do I do blood work? Do I do some extensive blood work to look at things a little bit
specifically
deeper?
for me, you want to look at your blood pressure.
Okay.
And your cholesterol. And when you go to the cholesterol, particularly you want to go to the LDL cholesterol, which is your bad cholesterol.
Okay, so there's LDL, and then there's which is the bad cholesterol.
HDL,
and then
which
the
is
HDL is the good cholesterol.
Total cholesterol, and
so,
triglycerides.
all right, where do I get HDL from?
HDL is made in your body. It's all made in your body.
Okay, so there's nothing dietary wise. Isn't there something I can do?
Yeah, HDL is more genetic. Very difficult to move. So
okay.
the
is
classic,
it exercise or diet? Or is that just a reduction of LDL for those two things?
Yeah, reduction of LDL. HDL is very difficult to move.
Okay.
That's going to be the classic, and that is the genetic piece you'll see.
Okay.
Dad had a heart attack. My brother had a heart attack. They'll come in, they'll have a high LDL, and they'll have a low HDL.
Okay.
And the HDL we can't move. We can do really well with the LDL.
Okay.
We can get that down. So that's, if you look at a modifiable medical, other than lifestyle, risk factor, that LDL cholesterol is predictive.
Yeah. Oh, yeah.
Yeah, and it's two different things. It's how low you get it and how long you get it there.
How long it takes to get it there, or how long you keep it there?
You keep it there.
Okay.
It's two different things. It denotes a lower incidence of events. It's the absolute amount you get it there, but it's also how long you get it there. And that's been a little bit of a kind of a shift for us in the last 15, 20 years, We used to wait till people were 60, 65, 70 and be like,
Right.
hey, we need to hammer this thing. Now,
And then you get on the cholesterol meds. Statins?
you do. And
Right.
yeah, so actually we could have a whole show on that, Bob.
Yeah.
The problem with statins in general is they were picked up by the lay press. So they've been implicated with Alzheimer's. They've been implicated with early diabetes onset. They have a different, as a cardiologist, particularly an interventional cardiologist, I use them differently. The whole underpinning of this, and I don't want to go too far into it, the whole underpinning of cardiovascular disease is inflammation. If you smoke, if you're a bad diabetic, if you have high blood pressure, if you have genetics, you inflame the inner lining of your blood vessels. And what that does is allow this circulating cholesterol to lay down inside the artery. So you start to form what we call a fatty streak. Interestingly, I tell a lot of my patients this. We first found those, or we did autopsies on guys coming home from Vietnam. So these were 18 to 22-year-olds. With the obesity epidemic, they're finding these fatty streaks in teenagers now that are morbidly obese. That's the first underpinning of starting cardiovascular disease. Statin drugs have an anti-inflammatory property in them. We don't know what it is. They make your cholesterol panel look great. They'll bring that number down.
Right, but do they affect that?
But they stop the progression of disease. That's why they're
Okay.
different than a lot of the other ones. We call it a pleiotropic effect, an unknown additive effect for us. It makes me sound super smart in a conference, but we don't know how they do it. To the point that for secondary prevention, you've had a heart attack. If I have well over 100,000 people in studies. If I put you on a statin, you'll live longer.
Yeah.
We don't need to put it in the
Keep
water.
the main thing. It's not like you're trying to solve all of it, but you're going, hey, let's take this risk
Right.
and reduce it as much as we can right now.
Yeah,
as quickly
I'm
as we
not
can.
saying let's throw it in the water, but a guy like
Sure.
you comes to me, Dad had a heart attack, my brother had a heart attack. I start looking at your panel, and that HDL's kind of low, and that LDL's 140, and I hear this every day, and they're like, yeah, doc, but man, I'm going to hit it. I'm going to CrossFit.
Going back to the gym.
And, sometimes I'll give them 6 months, or sometimes I'll just tell them, usually you're not going to move it that much. Enough that you're going to need to. I might need to hit you with a little bit.
All right. So before we get to the point where we go get the checkup and we have the blood pressure and cholesterol, those are the two biggies.
Those are
you want us
huge
to
for
keep an eye
me.
on.
I mean, there
Okay.
are other things, but those are good. Yeah.
So when
diabetes, that's a whole nother talk.
That's
But
a whole
if you're
nother
diabetic,
talk.
you've got to get that
That's a
controlled.
different thing.
Okay, yeah.
So looking at that bad cholesterol number and trying to keep from ending up with that bad cholesterol number. There, you mentioned inflammation, which I find interesting, and this may be a topic for another episode or even another time. But there's a lot of things, sort of homeopathic things. There's a lot of information now about certain food groups that encourage inflammation, and certain food groups that allow for less inflammation in your body and things like that, and just staying more hydrated. And there's just seems to be more and more research on kind of the dietary or the more homeopathic thing. Do those things also help? I mean, I would assume, the thing that comes to mind is dairy. I was just told, so many people, dairy causes a tremendous amount of inflammation that we are not aware of for a lot of people. That doesn't seem to be related or talked about much when you have cardiovascular
So my flat
disease.
answer, my simple answer for you is probably not.
Okay.
But the way that I was trained and the way I've always practiced, I'm good with things as long as they won't hurt you. I've had, I can't count the number of people with the herbals,
Yeah.
dietary changes, homeopathic. I don't personally have an issue with it. I believe in it. I believe it's one tool in the toolbox.
Okay.
You know, if it drops it, good. In my experience, if you walk into me with a LDL cholesterol of 156 and you cut out all the dairy in your life, you know, for the next 8 months, and you take some homeopathic remedies and a couple of herbals, and again, I believe in those, but it's not going to get you to where you need to be. I look at that a little bit differently than people. I kind of, and maybe let me ask you, but you know, someone walks into me and they're like, "Yeah, doc, but I take herbals. I'm an herbal guy, and I take, you know, this." And there is some literature with herbals. I'm good with that. But I always ask them, you know, if you take an herbal and you put it in your body, it's changing your body's chemistry to affect a change for the better, correct?
Ideally.
And so what would the definition of that be? A drug.
Yeah.
I've never really understood the difference. If I can make a drug in a lab and it's a drug that's been tested in 10,000 people versus I find a drug in a tree and purify it because it's still going to a lab. To me, it's all a drug. If I take a homeopathic remedy and somebody tells me you take these drops under your tongue and after a month it's going to boost your immune system, I have a hard time seeing like, well, how's that not a drug? You're changing the chemistry in your body. So I kind of throw them all in the tool chest. I just look at, you know, what's been looked at in the tool chest that has hard numbers behind it. And you're going to have
I think just to not to begin or
Does that
even
make sense to you?
but not to begin or even end a debate about it. I think that there's benefit. Most of us, our lifestyle and our diet leaves us deficient in a number of vitamins and minerals that we need. Yeah. And so in my mind, a lot of the herbal, the supplements, the whatever are helping to replenish vitamins and nutrients that we don't have enough of, that we need more of. Yeah. So that's not quite what you were saying, but that's kind of another thing.
This is so great you brought this up. I could talk to you for a couple hours on this. Completely 180'd on this. You know, thought I was mid-40s, pretty good shape, thought I was doing everything I needed to do, running half marathons, you know, working out, doing all this stuff. You know, finally break down and go see a guy that does more of a holistic, like a huge metabolic panel on you with labs. You know, I'm deficient in vitamin D.
Yeah, everyone is.
I stay in the sun.
Yeah, doesn't matter.
I stay in the sun. I'm deficient in, you know, there's like 5 things on my panel. After that, I've listened to some guys I can kind of tune you into that kind of study this a little bit more on a couple more podcasts. I've kind of dove into this because it was interesting to me. It all comes back around. It's all this inflammatory thing because when you look at it in general, everybody's pattern is going to be roughly the same. You're going to carry belly fat. You're going to be deficient in a few things you're telling me about. A lot of times your thyroid panel's a little off. Cholesterol levels are bad. It's middle-aged America. I personally, and I'm not going to go real in-depth in this, I think a huge thing that's killing us now are these processed foods. I mean, if you look at us now, sugar in our diet in 2021 is 70% higher than 1970. And this is coming from a guy that has the biggest sweet tooth in history. I mean, I can knock it out. But, yeah, Bob, long story short, I can't agree with you more. I've really, the last about 4 years, I've kind of dove deep into that and been trying to reading on that. And, yes, I agree with you. And that for me, that's been 180 because I was always the guy like, you eat the well-balanced diet, you do the stuff, you're good to go.
We're not getting the nutrients out of that stuff we used to. So,
yeah, which was an eye-opener for me. I mean, it was like somebody just punched me in the face.
That's like, interesting.
Yeah, it was me. I mean, you know, it wasn't my patient.
Right.
I pulled mine, and, you know,
you're like,
well, there you go, right?
Well, listen, man, we got to wrap it up. Thank you so much for spending time with me. What I wanted to just kind of finish with, we've talked about what cardiovascular disease is, things to avoid. I think just kind of takeaways, make sure we exercise. I mean, and even you don't have to join CrossFit. You just got to get out and walk 30 minutes a day, 5 days a week is what you said. Start doing that. Go have an annual checkup. Get your blood work done. Look at your blood pressure and your cholesterol. Make necessary adjustments to your diet. Exercise. blood work, cholesterol, diet, exercise. This isn't rocket science.
Yeah, one thing though, Bob, I do before I leave, I'd be doing a disservice to my profession. Every chest pain needs to be evaluated.
Yeah, thank you for saying
that. It does. I mean, we have a saying, time is muscle. Really good in the U.S. right now. If you look at survival rates from acute heart attacks or acute MIs, it's going up across the board. I mean, we're doing better and better and better and better, but we can only do that if somebody gets in. If you are having something going on and you sit on that, if you're having a massive MI, a fifth of my patients walk in and they're like, hey, man, if I can burp, this will go away. And I look at all their labs and their EKG and I'm like, no, this isn't going away.
This is not indigestion.
But if it scares you, and my rule of thumb for everybody is if that little voice in the back of your head is like, this is not right, get in. I would rather you get into an ER, your family doc, me, whatever, 20 times as opposed to sitting on the big one. Every chest pain needs to be evaluated. I mean, do all those things. You're right. That's going to keep it away. But if you're somebody sitting out there like, right now, like, well, doc, I'm trying to walk, but I kind of feel funny, get it looked at.
Yeah, that's great advice.
Yeah,
man, thank you so much.
Yeah, buddy, it's a pleasure, man.
Well, listen, thank you for joining us on Southeast Retirement Planners podcast. We want to bring content like this that maybe is a little bit beyond the balance sheet, some things that having some local experts in the area that are really serving our community in a powerful way. Jeff, thank you for all that you do for our community. Thank you for your friendship and all that you do for me and my family. I just appreciate you spending some time with us and look forward to the next episode. So thanks for joining us, everybody.
Yeah, thanks, Bob. I appreciate you.
All right. Securities and advisory services offered through LPL Financial, a registered investment advisor, member of FINRA, SIPC. Southeast Retirement Planners is not affiliated with LPL Financial or registered as a broker-dealer or investment advisor.